COVID-19 testing. It has ebbed and flowed as we've dealt with different COVID-19 variants since the first cases popped up in Pennsylvania. From waiting weeks to just seconds for results, Fox 43's Jackie DeTore finds out how testing for the virus has changed over the last 2 years.
We received confirmation of 2 presumed, and I emphasize the word presumed, positive cases of COVID-19 or coronavirus in Pennsylvania.
2 years ago today, that's all we knew.
Now, I'm saying presumed positive for a reason, because the results have to be confirmed by the CDC.
There have been more than 2.2 million confirmed cases in our state since then. But on March 6, 2020, getting a COVID test was nearly impossible. At the time, the only place in the entire state that could test for the coronavirus was at the Department of Health State Lab in Exton.
We are continuing to increase our testing capabilities at this state laboratory, and we are also aware that commercial labs are coming online to also begin testing.
That was then, when Dr. Rachel Levine was the Secretary of Health for the Commonwealth.
It was very challenging about the limitations in testing that we had in the spring of 2020 as we were trying to work to contain the virus and then to stop the spread and bend the curve. Remember all those terms.
Now she's known as Admiral Levine, the Assistant Secretary for Health under the Biden administration. Not only has her title changed, but the way we test for the virus has changed a lot, too.
Now we have 20,000 sites throughout the nation.
But 2 years in, we're still not perfect. The Omicron variant hit the U.S. hard. Testing companies, sites, and labs were all overwhelmed. People were waiting hours just to get a test and days to get results. Pharmacies were either sold out or limiting the number of at-home tests you could buy.
Why were we not prepared in that moment for the influx of testing that we needed?
It took a number of weeks or a month or more to gear up the manufacturing and the distribution for those tests. But we are going to make sure that if there's any further variant, that through ASPR, the Assistant Secretary of Preparedness and Emergency Response, and her team, that there are tests available for the United States to be able to deal with any future variant that might occur.
Part of the plan to make sure that doesn't happen again was to send at-home tests to Americans.
We have bought 1 billion tests to send to Americans for free.
But at the end of last month, more than 200 million tests have yet to be claimed. A big reason why is because the COVID-19 numbers dropped dramatically and other people just don't want to test anymore. As for the future of COVID-19 testing, Levine says it's constantly evolving to be more accurate and simple.
You know, the president has made it very clear that we are moving towards a time when COVID-19 will not disrupt our daily lives.
As we evolve, so has Levine's message to Pennsylvanians. Back in 2020, it was a lot of this.
Stay calm, stay home, and stay safe.
Now, 2 years later,
we want people to stay informed. We want people to stay connected, and we want people to stay safe.
And if you have a consumer story or scam you want me to look into, Fox 43 wants to find out. Let me know. Email Fox43 Finds Out at fox43.com or join the Fox 43 Finds Out group on Facebook.